So why are you making these cuts?
First of all, we haven't made cuts. We've only in Washington would those be called cuts. The reductions that are proposed are reductions in the rate of growth over the next 5 years.
The nonpartisan Congressional Budget Office estimates that more than 10 million people will lose access to Medicaid because of the bill under consideration right now in the House.
The future of Medicaid, the federal state program that provides health coverage to over 70 million low-income Americans, is at the center of a heated political debate. A proposed bill in the House of Representatives could lead to major changes in Medicaid funding, with the Congressional Budget Office, CBO, estimating that over 10 million people could lose coverage if the bill passes.
Comments very much. Now, let me turn to an issue, Medicaid. The nonpartisan Congressional Budget Office estimates that more than 10 million people will lose access to Medicaid because of the bill under consideration right now in the House. In fact, CBO didn't even get to score all of the Medicaid provisions, so it could be higher. But the consequence of that is millions of people losing Medicare will mean that many more people will go to the emergency rooms because they don't have a doctor. Many community health centers will close because that's the margin that keeps them open. Nursing homes will likely close. In fact, frankly, it will probably undermine significantly the healthcare systems in every state in the union. So why are you making these cuts?
First of all, we haven't made cuts. We've only in Washington would those be called cuts. The reductions that are proposed are reductions in the rate of growth over the next 5 years. And those reductions are to eliminate waste, fraud, and abuse. And I'll explain to you, there's 1 million people now on Medicaid who are accepting Medicaid or collecting from Medicaid in 2 states. That's illegal. They're stealing from the Medicaid program. We've now been able to identify them, which no other administration was able to do. There are 2 million people who are collecting both Obamacare, or 1 million people who are collecting Obamacare and Medicaid. That's illegal. It is also a theft. There are 1 million illegal aliens in the states that have allowed that, like California. And as soon as we made the announcement that we are not going to allow that funding anymore, Gavin Newsom followed by making his announcement that he's not going to fund it anymore. So his compassion ended where he had to start paying for it. The remaining, and there's only 8.5 million people affected by this. The remaining people who are affected are able-bodied male workers, males, who refuse to get a job, who refuse to even meet the minimal thresholds that President Trump has demanded, that they be looking for a job, that they be getting education.
Excuse me, Secretary. That's rhetoric, not reality. You're going to have 10 million people without health care. They're going to the emergency rooms. It is going to undermine the health care system in every state of this country, and you'll be responsible along with the President. Thank you.
Critics warn that this would strain emergency rooms, force the closure of community health centers and nursing homes, and destabilize state healthcare systems. Supporters of the bill argue these aren't true cuts, but reductions in the rate of future spending aimed at eliminating fraud and inefficiency. They point to cases of double enrollment, undocumented immigrants receiving benefits, and able-bodied adults not meeting work requirements. This debate highlights a broader struggle between cost control and access to care, raising urgent questions about who should receive public health benefits and under what conditions, with significant consequences for millions of Americans.